Welcome to the More Than Scrubs podcast, a podcast where dentists and healthcare professionals can learn how to thrive in or beyond their 9-to-5 job. I mean, don't get me wrong, I love my scrubs. But in this podcast, I want to explore how we can build a side hustle, a business, or excel in our careers so that we can have that work-life balance that everyone's always talking about. Healthcare careers have evolved so much in the past decade, so let's find a way that we can evolve with them. My name is Dr. Kamal Chopra. I'm a dentist, a business owner, and I want to take you on this journey with me to find out how we can be more than scrubs. So let's dive straight into it. Hi everyone, welcome back to the More Than Scrubs podcast. Today I've got my friend Nikki here. Can you introduce yourself to us?
Hi, thank you so much for having me on here, by the way. But my name is Nikki. I'm a general dentist working in Southeast London.
Great. And what else do you do, Nikki, apart from just general dentistry?
So I've developed a little passion, I guess, and looking more into sleep medicine in adults, but mostly actually in kids, and doing early interceptive orthodontics.
Amazing. And this is something that really excites me to talk about. And when we first talked about it, I had like goosebumps and I was like, this is so interesting because a lot of people don't know about it. So firstly, I just want to go back to when you qualified. And when did you realise that you wanted to do something like this as well?
Ooh, good question. So I qualified from UCLan in 2021, and then I did my foundation year in kind of like Dartford, Kent area, and then just been in general practice since. I actually enjoy it, but I knew that I wanted to do something else. So I knew that I didn't want to do cosmetic dentistry, which is what most dentists want to go into.
Yeah.
But I couldn't figure out what I wanted to do. And I've always enjoyed treating kids or like being around children ever since I was like a teenager. So I guess combining the two together, I've learned more just from like online and just talking to other people. And I realized that, oh, actually, there's something that I'm really passionate about.
Okay, so you qualified from UCLan. Is that your second degree?
Yes, it is.
Shall we talk about that a little bit as well?
Yeah. So I didn't get into dentistry first time round. I actually had all 4 offers, but I didn't get the grades.
Okay.
So that was really
that's
hard.
still a really good thing that you had the offers because mine was the opposite.
So I knew that I did well in interviews, but I
Yeah.
just couldn't get the grades, or I was being too ambitious with my A-level choices. But yeah, and then I decided to do a degree in biomedical material science. That was honestly the hardest degree. Like I would actually say it's harder than dentistry. And it was kind of what the way the course was set out. So essentially, it was based at Birmingham, by the way. And essentially it was part of like 5 different departments. So instead of making their own course under like one department, we were like part of the engineering department, the materials department, the medicine, dentistry, and then we had also our biomed and then biomaterials lectures as well. And then so we did some of their coursework, we did some of their exams, so it was just really heavy on both.
I can imagine.
It was honestly like...
And you got through it.
Yeah,
well done.
Somehow. But during my second year, I basically that's kind of like the turning point was for me in my personal journey and why I'm so passionate about early interceptive orthodontics. So in my second year, I essentially failed an exam, even though I was performing like really well with my coursework. So they were like, oh, that's strange that you get like, bursts in your coursework, and then you fail your exams. Like, we've never heard that before. And long story short, that's when I got diagnosed with a few things. I mean, I'm happy to share. Essentially, I have was diagnosed with dyslexia, anxiety and depression, and a partial hearing loss, all in the same week.
Oh my god!
So that was a lot.
Yeah,
that was a lot.
And how did you get to that diagnosis?
So I guess because there was such a difference within like my performance at university, they were like, you need to like maybe get checked out by we were called it like well-being services, student services. And then, had some like counseling, and they were like, okay, yeah, you're obviously struggling mentally.
Yeah.
And then during those counseling sessions, they're like, oh, have you ever like thought about getting tested for any learning difficulties? And me being like the proud Asian, I was like, no, definitely I don't have anything. Like I'm like, I'm a high performing student, I thought anyway. But yeah, and then the day that I got diagnosed with dyslexia, the assessor had lost her voice. So she was whispering all of the questions. And as you can imagine, I was like, pardon, can you repeat that? And so at the end of it, she basically asked me to go and get my
Oh
ears
my
checked.
gosh.
So the next day I went on and got my ears checked, and they actually had to repeat the test because they weren't like, they were just like, let's just make sure.
Yeah.
And I actually have 50% hearing loss in both
Oh,
ears.
wow.
Yeah.
Wow.
So
But that must be, I guess, not nice, but what's the word? Like reassuring to know that it wasn't like you, if you know what I mean. Like it wasn't just like in your head or whatever. Like there
yeah,
was something going
to
on,
be
right?
fair, at that point it was a shock, but also as I processed it gave me a lot of like answers.
Yeah.
Exactly. Like it even went back to like GCSEs. I remember like I was like predicted A star in French, but
Yeah.
and then in my listening exam I got a C, and basically they played the listening exam in like a massive hall, and all I could hear was like echo or like
That is so
reverb, and I
tricky.
couldn't hear anything. And then
Yeah.
I was like, oh, I couldn't answer any of the questions. Yeah, and I was shocked, and obviously I was like, oh, but I didn't really have an answer for it. And I guess that was like, oh, maybe that's why I didn't do that well in that exam.
Yeah.
Yeah, so I guess it was like the start of something. And to be fair, like at first I was really ashamed. I was like, oh, no one's gonna like me because I'm deaf,
Oh my
kind of thing.
gosh.
But you become more resilient, you become
Yeah.
stronger. And to be fair, I always say everything happens for a reason. Like I am a Christian, so I believe that God puts me in these places for a reason.
Yeah.
And I was thinking, if I actually got into dentistry first time round, I would have definitely dropped out because I wouldn't have had the support that I needed for like exams or, everything like that. So
Yeah.
because I had that support in place when I eventually got into dentistry, yeah, I had like, extra time in my exams, and that made a massive difference. And being in like a smaller exam setting
Yeah.
meant that I didn't have as much anxiety. I think I just got really distracted. Like I kept looking
Of
at like
course.
everyone
Yeah.
instead of actually concentrating. Yeah, so that's a little bit about my
Thank you
little
for sharing
story.
that.
Yeah.
That's actually really amazing to hear. And I feel like, yeah, it's just to say sometimes it's nice to have the answers about why certain things are the way they are.
Mm,
And I think we'll go more into that as well in terms of airway and
yeah,
things like that.
definitely.
So how was university for you?
So
For dentistry?
dentistry,
Yeah.
yeah. So UCLan is a graduate entry course. So the way it's set out is quite small. I think there's about like 28 people in the whole year. And then it's split up into four what we call dental education centers. So you split into four different locations. So it's a very like tight-knit small university. And I think it was great. We had loads of hands-on experience. And actually we were under like an NHS trust, so we knew how the NHS worked.
Okay.
We even like our patients even paid. So we talked about
That's really unique.
yeah, we talked about band 1, band 2, and band 3.
Okay.
And of course you're doing massive treatment plans
Yeah.
for band 3, but it was good to understand how the NHS worked. And we basically treated the patient as a patient. So the patient would come in, and then we would say, oh, you've got periodontal disease, you needed like a root canal and a crown, but we would treat that patient as we went on with the years. We would treat that same patient.
Not just a tooth or a
Yeah,
certain...
and it's like, yeah, you don't get sent to different departments.
Yeah.
It was just, yeah. And if you couldn't do the root canal, then you would refer it to like an older year, but then they would refer it back to you to do like the fillings. So yeah, it was quite good. I enjoyed living up north. So it was up north. It was very close to the lakes, beautiful nature. a lot cheaper as well.
Because you live in London,
yeah.
right?
My goodness, yeah.
Yeah, the contrast.
London just swallows all of my money up that I have.
Yeah. But okay, so with I was gonna go back to, sorry, I lost my train of thought. Back to how the NHS, like you kind of worked within that system, and do you feel like that's how most universities should do it? Because we kind of had that at Peninsula, so we did treat the whole patient, but we obviously never charged them. We didn't kind of know how NHS works. We had 1 week where we had an NHS week, and we went to Exeter, and we had, like, I was the associate for the whole day, and I had my own nurse, and I earned like 7 UDAs that day, and I was so excited. So that was kind of my only glance into.
We had a whole term
Did
of
you?
working in a practice.
Oh my God,
Yeah.
that's so great. Don't you think that's really good though?
It definitely set me up for foundation training. Like when I
Yeah.
got there, I was like, oh,
I
the
know how
jump
it
wasn't
works.
as
Yeah.
big. But you know, I think there's benefits to working in hospital and being trained. But I knew that I never wanted to work in hospital. So for me, UCLan was like the best course because I'm a very hands-on person. It was very hands-on.
Yeah.
And because it's a newer university, they were slightly more up to date with things like we, you know, learnt rotary, for example. I even had, I think, more than one lecture on whitening because I heard that, well, from Enlighten, essentially, no one gets taught about whitening at university.
Yeah.
Yeah, so I think
A bit more of a modern
very
approach.
modern,
Yeah.
and the teachers are mostly all GDPs as well
Okay.
instead of specialists. So that was quite interesting that you could learn from you know, other dentists that have worked in what I call the real world.
Yeah, well, you're about to go.
Exactly.
So it's not like it's hard to be taught by somebody that's really out of it, because they're not going to set you up for what you're really going to expect when you get there.
Yeah,
right?
yeah, exactly.
Yeah.
So no, I loved it, and I would recommend it to anyone that's done a degree.
Yeah.
Yeah.
And when did you get into the airway? So I know you have personal experience with it as well.
Yeah.
But when did you kind of know? I think that a lot of people or dentists don't even know it's a thing, to be honest. And we haven't really been taught it at university. I don't think there was anything
No,
on the airway.
nothing. I don't think any dental school teaches anything about airway. I mean, most dentists don't even know anything about breathing.
No.
And actually, it's like one of the most important things. Like we do it all day,
Yeah.
all night, but most of us actually breathe incorrectly, including both of
Yeah.
us.
That's how we
We've
bonded
discovered.
over our breathing issues.
So yeah, how did I get into it? So I guess definitely from a personal journey. I feel like I'm sharing my whole life story. But essentially, going back to when I was a kid, looking back at all of my like photos and stuff, my mouth is like open in all of the photos. So definitely was a mouth breather.
Yeah.
Growing up, and I actually didn't really have very good dental experiences. So I was constantly at the dentist. I would either need a filling or an extraction. I remember seeing the orthodontist from probably the age of like 8, and they kept saying, "Oh, you're too young. You know, come back next year and we'll review it." So
Yeah.
I remember going to orthodontists a lot before I actually got braces, and they just kept saying I was too young. And then obviously when I turned 6 or 7, all of my teeth were basically like shark teeth. So what that means is that your adult teeth come through either lingually. Instead of, you know, pushing the actual baby teeth out. So at one point, I probably had, I don't know, maybe like 30 something teeth in my mouth because none of my baby teeth fell out. So every time I went to the dentist, another tooth would have to come out. And unfortunately, my dentist wasn't very good with children, and my mum had to pin me down.
Really?
Yeah.
Oh my gosh.
I never understood. Obviously, I was like a obedient little child, and like I
Yeah.
was like, oh, this is the only way that we knew.
Yeah.
And you would always listen to what your doctor or dentist says. So and to be fair, the most traumatic thing that I remember is my mum's face. Like her like disgusted
Does
face.
she know this?
Yeah, I told her recently, and she was like, "Oh, it's just like it felt like it was really painful for you." And I was like,
Oh,
"Well, yeah, the local anesthetic hurt
yeah.
awfully, and it was just more the repetition, so like repeated trauma."
Yeah.
And then once all my baby teeth fell out, I went to the orthodontist, and they were like, "Oh, no, there's no space. You're super crowded." Like my upper laterals were behind my centrals, like
Okay.
severely crowded. And they were like, "Yep, you need all four premolars out."
Yeah.
So back I went, had another
You're
four
used to it
adult
by
healthy
now.
teeth out.
Oh my
Yeah,
gosh.
it wasn't great. And at that
Yeah.
point I was really happy to have straight teeth.
Yeah.
But and then that's when all of my symptoms kind of started to happen without me knowing.
Mm.
Obviously, it's only when I've looked back that I realized that, oh, maybe that was the turning point. But essentially, in the UK or in Europe, actually, most orthodontics is what we call retractive orthodontics. So
Yeah.
we actually push everything back.
Mhm.
So we often take out teeth and then push it back essentially. Whereas another alternative way and American way more so is
Mm.
expansion. So
Okay.
that's when you can widen the arches
Mm.
and make space instead of, removing teeth to create a nice
Is there a
uniformed
reason why
arch.
there's a difference in
I
American?
mean, I'm not an orthodontist, so
Yeah.
obviously I haven't had like traditional orthodontic training. But from what I hear, it is just the way that you've just been taught.
Yeah.
Technically, extraction cases are quicker, but that's also another political thing, is that for NHS funding, you're going to get paid the same amount to extract teeth and make them somewhat straight,
Yeah.
rather than, the correct or like the slower way of doing it.
Okay. Yeah. That's really interesting
Mm.
because obviously, I guess, do you think people understand the repercussions of it?
No,
Yeah.
definitely not. I mean, at one point, I don't know if you have any patients, but if you think about like maybe like 40, 50-year-olds, a lot of them, they say, "Oh, I haven't had braces, but I had teeth out."
Mm.
So that's called like guided extraction. So they feel like, oh, there's no space, so we're going to take out these teeth, and then um they have enough space in their mouth, but often their teeth are very crooked. They've got
Mm.
still very narrow arches. They
Yeah.
haven't treated the root cause, but they've just taken out teeth and then hoped for the best,
Oh
maybe.
my gosh.
Yeah, so there's been different methods. I mean, there's no necessarily like right way or wrong way. Same in medicine. I feel
Yeah.
like, when you go to an I don't know, if you've broken a leg, there's different ways of like fixing it. You
Yeah.
can be more minimally invasive, or you can go, straight in.
And I guess you could argue in certain cases that is the appropriate way to do
Exactly.
the
And I feel
treatment.
like my passion is more about prevention.
Yeah.
So obviously when a kid is growing, their bones are soft, they're so malleable, they're compliant. So you can actually encourage that bone to grow whilst they're growing, rather than get to a point where they're at teenagers, actually their skulls have finished growing.
Yeah.
And then you're like, well, we can't actually make any more space unless they have surgery.
Yeah.
So we've got to
Now
now
go and
take
fix what's
fix the
already settled,
yeah.
right? Yeah.
So a typical like NHS dentistry, or even actually what we've just been taught at
Just
university.
traditional, right?
Yeah,
Yeah.
traditional. Like this is nothing new. It's just
Mm.
that we're not taught it, and it hasn't been very well educated, like, in terms of spreading the awareness of it. So I
Yeah.
guess that's one thing. But normally you see the kid, you make sure they've got no decay. That's what we're trained to do. If they
Yeah.
have decay, you fill it or you take out the teeth. That's essentially it. And then if a mum comes in and says, "Oh, their teeth are not straight," you'll be like, "Oh, don't worry. When they have all their baby teeth out, we can refer them to orthodontists and they can get braces."
Yeah. That's
Sounds
what I
familiar.
do that.
Yeah.
Yeah.
And then so when I found out that actually you can start braces from the age of like 5 and then prevent this all from happening, I was like, why do we not do that?
Yeah.
And it's basically like a funding issue.
Yeah.
And of course, I don't know if you remember like learning about like removable appliances when you
Yeah.
were younger. do any orthodontists do that?
No, and that's what's crazy, because I think if I was to see a removable appliance, I would like panic. What is that? Like, I know I read it in a book somewhere,
Yeah.
but yeah, it's not a common thing
It's
to
not
see.
common. I mean,
Yeah.
some orthodontists do them,
Yeah.
but
It's more like a luxury, I would say,
yeah.
right?
So again, it is a political thing. So
Yeah.
they only get paid like 4 units of orthodontic activity versus 21 if they do like fixed braces with extractions, essentially.
Okay.
So the amount they get paid is very, very different. And
Yeah.
often, if you do the treatment early, they don't qualify for braces later on. So
Wow.
as a dentist, if you want to earn money, you would rather get 21 units, whatever
Yeah.
that value is, versus 4.
Exactly. And you know that I love talking about this UDA situation.
I know.
So yeah, I think it's just crazy that it has to come down to the funding of something impacts the lives of our patients so much.
Yeah.
And half the time we don't even know it, or they don't even know it. And do you think that in your experience now that you're spreading awareness to your own patients, do you feel like it's something that they're very keen on learning more about?
So yes, a lot of them are.
Yeah.
And I haven't yet seen a patient that's gone, "You're talking rubbish."
Yeah.
Like, I think when I explain it to them in a way where it just makes sense.
It does.
Right?
Yeah.
I don't think I've even explained how it makes sense, but yeah, they just go, "Oh, that makes sense," and like, "Oh, but," and then I'm like, "Oh, well, it's unfortunately due to the like NHS funding, it's just not available in the NHS right now. However, if you are interested, we can explore this on a private basis and hopefully prevent your child needing, more extensive surgery, having healthy teeth out. But more importantly, it affects their breathing."
Yeah.
So
I want to talk more about that.
yeah, let's
So
talk about
tell
that.
me more about the breathing, because I'm
So
obsessed.
so we should all
Yeah.
ideally be breathing through our nose 24 hours a day, okay? And if you think about it, every single mammal on this planet all breathe through their nose. It's only humans that have the luxury of breathing through their mouths, and it's just because of habit. Like, no one teaches us how to breathe because it's innate. When we come out of our mothers, bodies, we should be already be able to breathe.
Yeah.
But due to, for example, soft food diet, bottle feeding, dummies, thumb sucking, pollutants in the environment, there's so many different things. A lot of us end up mouth breathing. And like, for example, if you've got a blocked nose, like right now, Cornwall's got really bad hay fever.
Mouth breathing my life away at this point.
So then you choose to mouth breathe, because
Yes,
obviously you want
it's
to
like
get
the easier option
exactly
in a way.
yeah. So all of us should be breathing through our nose, and the way to do that is that your tongue is super important. So your tongue should be resting at the top of your mouth, just behind basically like your incisors, just by the rugae, the incisor papilla, just behind that's called the end spot. And then it's not just the tip of your tongue that should be at the top. Your whole tongue should be flat against the roof of your mouth.
And what if it doesn't go all the way? I don't think mine does.
If it doesn't go all the way, then you probably have a tethered tissue, so like a tongue tie.
Yeah.
So I mean, a tongue tie is another big topic, but essentially, if you can't put your tongue all the way to the roof of your mouth, then you aren't breathing optimally. So if your tongue's at the top of your mouth, your lips should be sealed, and then you can physically feel the way that you breathe differently. So if you try now, just breathe normally.
Yeah.
And then try and put your tongue to the top, and then try and suck up your tongue so it's resting at the top of your mouth on your palate, and then now breathe. And then when you breathe, you'll be able to get a lot more oxygen through your nose.
It does definitely feel different.
Feels
Feels
different.
like a fuller breath.
Well, there you go.
Yeah.
But you're compensating by breathing through your mouth. Of course, because right now you're congested.
Yeah.
It's a bit more difficult.
Whoa.
But yeah,
I wish I could do this all the time.
If we learn, I mean, we all can learn. It's just like you see a personal trainer. You can also basically retrain how to breathe, doing exercises, and then you can actually become a nasal breather.
I really want to do that.
Yeah,
That's like, that
I'll
should be
help you.
my New
That's
Year's
okay.
resolution. Half year resolution. It's June now.
Yeah.
By the end of the
No,
year.
yeah, definitely.
Yeah.
It's really important. So essentially, when you're breathing through your nose, and your tongue's at the top, what that means is that you're actually getting enough oxygen through your nose,
Mm-hmm.
and that means you're getting enough oxygen to your brain, and obviously, of course, to the rest of the body. So in children,
Yeah.
that's really important because they're growing, but also in adults, it's super important because that's how we get restful sleep.
Yeah.
And that's how we're actually being able to function and optimize the way that we perform during, work as a dentist or doing whatever your job is. And often we always say that, oh, we're really tired, or we need like afternoon naps, or other symptoms as like grinding teeth,
Yep.
snoring.
Tick.
Yeah, all of these are all symptoms of sleep
And
disorder
appearance.
breathing. Yeah,
Appearance. So
massively.
like, since growing up, I've always had like eye bags or whatever
Yeah.
you want to call them. And I just learned this year that that's actually
Correct.
very much related to your breathing. It's not
Exactly.
that I was a 2-year-old and I was just tired.
So yeah, back to basically, if your tongue is at the top of your mouth, you're
Yeah.
actually stimulating the palate. So that palate knows that it needs to actually grow outwards. So your tongue is a natural orthodontic force.
So it can change the way that you...
Massively.
Wow.
So obviously not
Even
as an adult.
yeah,
Not now. You'd
as a
have
child.
Yeah, as a child, because everything's still malleable.
Yeah.
So essentially the tongue is actually guiding the jaw growth.
So you can teach a child to do that?
Correct. Yeah. So in
Easily?
fun way, easily,
Really?
yes. Just make it super fun.
Yeah.
So like one of the exercises that we can get them to do is like pull like funny faces, like act like a fish,
Oh my God, I love that.
and then like puffing them out. And then of course like clicking like and then eventually you can get they do beautiful suction holds.
Wow.
So that's what we call myofunctional therapy.
Love that.
So it's like a PT, but for your lips, your mouth, and your tongue. So it's super important. And
Yeah.
the fact is that you can get that jaw growth without braces. So instead of us treating the absolute car crash when they
At
come
the
to
end, when
at
it's
the end when
crashed,
they
yeah.
need, jaw surgery or like extractions, actually you can prevent a lot of that by treating them from perfectly from even from the age of 3. But would say as a dentist, I'll probably say age of 5, we can definitely be doing that. And then by the time they go to secondary school, they're done.
Oh my God. And I just want to literally say, like, everyone listening, did you guys know about this? I feel like 1% of us would have heard of this, but which is so crazy.
Yeah. So I mean, I didn't know any of this, and it was only because obviously I've had premolar extractions.
Yeah.
And then I was having like sleep issues. I had like loads of tightness in my like shoulders and neck. And I just couldn't find an answer. I tried, all sorts of traditional, well, Western medicine. I've tried more holistic approaches, and it's only literally in the last like year or so that I realized I'm like, oh, I want to actually get down to the root cause,
Yeah.
and figure out like what's going on. So I've got a tongue tie, but it's what we call a mid restriction. So it's like not one at the top, which is more obvious to see, but one that's basically halfway along your tongue.
Okay.
And then also because I've had retractive orthodontics, everything's basically pushed back. So then my airway is also compressed.
Yeah.
So I find it more difficult to breathe. Does that make sense?
It does make sense. And firstly, how did you get to that? Because, okay, you're a dentist, so I guess that helps. But like we also touched upon, most dentists don't know about this.
That's
so
true, yeah.
How did you actually learn that this is a thing and get into learning more about your body?
Yeah. So I think growing up, I mean, if anyone actually knows me in person, like I am a very active person. Like I love going to the gym, like trying to eat healthy when I can.
Yeah.
Obviously, love a treat from now and again.
Yeah, we all do.
But also like I love like, nature and like just doing things. But I'm also quite health conscious in that way. So you know, at one point in my life, I thought maybe my side hustle could be a PT. Or maybe, you know, something else. I was trying to figure out what I wanted to do that was a bit different to dentistry, but nothing quite stuck. And then I essentially learned about airway dentistry online, I think from like an
Just out of
American
curiosity.
I think it was like maybe like 2-3 years ago.
Yeah.
I just saw something called the Breath Institute, and I
Mhm.
was like, oh, what's this? And then
So interesting.
yeah, very interesting.
Yeah.
And then essentially one of my great mentors, Dr. Aoife, she's honestly been amazing, like teaching me everything that she knows and helping me with like cases and guiding me. But she's essentially set up something called Airway School with another dentist called Dr. Claire Simon, and they're both great human beings, but also they basically set up this school where they set up like organize events about airway, or um, about essentially learning more about sleep medicine and just raising awareness as well.
Yeah.
But it's not just for dentists. It's really important to know that obviously breathing is not really to do with teeth.
Yeah.
So it's actually a collaborative team approach, and it's involved with like ENT, even like osteopaths, something called craniosacral therapy, and also like myofunctional therapists as well.
Yeah.
So we have to work together as a team to figure out each patient to see how we can help them and how we can optimize their breathing.
I love that because, yeah, I guess that is the most important thing we can do as people is breathe. So doing it well is really important.
Because like I'm sure like people know like sleep is really important.
Yeah.
And I know that, you know, on social media you've probably seen something like mouth taping, things like that.
Yeah.
These are all tools that can help us sleep better, but also breathe better. But essentially we need to kind of we need to learn how to breathe optimally in order to optimize our health.
Yeah. Do you feel like it's helped that, I guess, after COVID, everyone is all about optimizing their health anyway? So it's kind of we're in that direction.
Yeah.
Do you feel like before that it wasn't really something that people cared about? Or
To be fair, yeah, I think COVID has made a difference to that because we're spending more time at home, and I guess like we've realized that actually at any point we could pass away, or something can happen to us. So by, you know, prioritizing our diets, our health, it obviously makes us more stronger, and have a better like immunity, things like that. So yeah, I think that definitely has helped.
it's all connected at the end of the day. So like you said, even like working with different types of therapists and osteopaths and things like that, I guess what we're saying is everything in your body is connected, and it's really important to like step back from, I think, as a dentist, we are probably one of the most important people that could help, like even if it's just
100%.
down to screening, because like we said, it's all
Exactly.
connected.
Yeah.
We're literally looking in the airway or the mouth. Like,
Yeah. I
all
mean,
the
just
time.
like how we are all trained to do an oral cancer screening.
Yeah.
Like, I don't know if you've had patients, but I've had patients that are super grateful because I've referred them for, you know, a lesion on their tongue,
Yeah.
and they actually ended up having, you know, cancer.
Mm.
And same with airway as well. I saw a young child, I think she was about 6. She essentially was snoring, was mouth breathing, her tonsils were massive. And I spoke to the mum, I was like, oh, have you, you know, thought about seeing your GP to, you know, get a referral to ENT? And long story short is that she had to get her tonsils removed, and now she can actually sleep, doesn't snore anymore. She can actually close her mouth and breathe through her nose because there's not these 2 big balls in the way of her
Blocking everything.
airway.
Yeah.
Yeah. So yeah, I think it's important to at least know to screen and then signpost where to go. I'm not obviously expecting every single dentist to do what I do, but at
Exactly.
least understand it, know it's a thing.
Yes.
And yeah, there's actually a lot of tools out there that can help. but even just see if any signs and symptoms of like even grinding, snoring, and any like behavior issues. There's loads of studies that link, like for example, ADHD, or like learning difficulties, like bedwetting,
Mm-hmm.
things like that. They are all linked to actually sleep disordered breathing.
So
But from a
crazy.
dental point of view, if you've seen a child that has overcrowding, any cross bites, narrow arches. So if you've got a narrow arch, the tongue has no space to go. So it needs to basically widen. And the younger that they are, the easier it is to widen their arches. But not only is it that they can get wider arches for, a nice aesthetic smile and better facial structure, it's more so that they can actually be able to breathe for the rest of their life.
Quality of life.
Yeah.
Right. As a general dentist that knows about the airway, how would you advise? Because obviously I think the problem starts with education at
Massively.
university, right? So ideally, everybody, the curriculum changes and we all learn about the airway. But let's say that's not going to happen anytime soon. So let's say that they've had this podcast, they've seen something online. How would you recommend that? Like, what's the steps that they take? So they might know how to kind of spot those signs that you've spoken about, but then where do they go next? Because that's definitely happened to me. My own nurse, she won't mind me saying, but her son has these kind of issues that you're talking about, and she's asked me several times, and I was kind of like, I don't really know where to signpost you. Yes, he has this problem, but shrug, right? What do we do after that?
It's hard.
Yeah.
Obviously, you know me now.
Yeah.
So essentially, if you do know a dentist or an orthodontist that is into airway. So if you see any of these children that have any of these signs of like narrow arches, crowded teeth, actually in all kids, they actually should have gaps in between the primary teeth. If they don't, they're already technically crowded. So that's already a sign. But yeah, I would say refer to a dentist that knows what they're doing, basically someone that's had the education.
Yeah.
There's a group of us.
Okay. So it's a good idea to just know that there's a group and maybe have some contacts. If the parents aren't maybe responsive to that, maybe because of finances or whatever, GP?
The issue is that in traditional medicine, it's not quite recognized. I mean, it's getting more recognized in America. So now the Association of American Pediatrics have like said that you need to be able to screen for sleep disordered breathing now. But in the UK, it's still kind of, we're very like symptoms based.
Yes.
So if you've got a symptom, you go to a doctor, they somehow give you some medication for it. They never look at the root cause.
Yeah.
So it is, a system issue. So yeah, it's really like explaining it in a way so that they understand, but at the same time, just like how some people eat healthily and they understand it, some people will still
So you've done
eat
your
unhealthily.
part
Exactly.
by letting them know, and
Exactly.
then the rest is kind of up to
Because
them.
honestly, like when I speak to my patients about it, yes, some of them can't afford it, and that is, a system issue. And hopefully one day the NHS will bring back a rewarding system for doing early interceptive orthodontics. But until then, by explaining it to them, being like, this is more than just the teeth. It's more about how the jaw's growing. It's not because your teeth are too big. It's actually because your jaw's too small. But that means that you're not being able to breathe properly through your nose, because the top of your mouth is actually the bottom of your nose. So if you've got a high palate like that, you've actually got way less surface area for your nose to be. Whereas if it's wide,
Which
and
is how
actually
it
flat,
should
how it
be.
should be,
Yeah.
you can get actually a lot more oxygen in there.
Mind blowing, honestly, it really is. And I could literally talk about this all day, but the point of this podcast is actually to let people know that there is more to dentistry or healthcare professions than just kind of the normal traditional thing that we're used to. So if somebody's listening to this, I know if I was listening to this, I'll be like, oh my God, I really want to know more. So what steps can they take to become like you? So firstly, you said do some research just about the topic itself. What can I do next?
Okay, I mean, I'm still on this journey, so I'm not
Yeah.
professional, but I would definitely recommend to do some courses. So I've personally been on the Airway School courses. So they do one for adults and one for children. So for adults, it's mainly like, mandibular advancement devices, but again, screening for it,
Yeah.
and assessing their sleep. It's more just asking the patient, how do you sleep? Do you wake up in the night? Things like that.
Yeah.
And then children is more hands-on in terms of trying to guide their jaw growth and improve their habits from a young age. Also, I'm currently doing a diploma with Dr. Stefan Decker. It's been amazing, but essentially that is using aligners mostly, which a lot of our dentists are used to doing, and that's already correcting a lot of the issues, because we all know that if we do aligners anyway, that expansion is really predictable with aligners, and that's exactly what we're doing with children.
Okay.
So yeah, just doing courses like that. And as I mentioned before, the Breath Institute have great courses. So it really depends what you want to learn. If you're more comfortable with fixed braces, there are also fixed braces available.
Yeah.
There's different techniques. You've got to figure out what route you want to go down and what you believe in. So I think what's important is that it needs to align with what you are comfortable with, because just like you might prefer Venus composite versus Filtech, it's it's composite, but at the same time you're using
It's your
different
preference.
materials or like a different tool. It's a bit like that preference, what works well in your hands, and you'll learn just with experience, which I'm still learning on.
Exactly. And is anybody, you mentioned a few people, but anybody that influenced you to go into this path?
Ooh.
Or you kind of just were like, I like it, and
I feel like, because for me, most people that fall into this pathway, if you want to call it, is due to personal experience. So often it's because it's your own, which is my journey, or it's usually when you have children and you've noticed that one of your kids is having an issue, and you just have like a gut feeling that something's not quite right. So that, or someone in your family has, like, for example, sleep apnea. So that's usually what kind of drives you to do something, because at the end of the day, like, this is not about teeth. It's not about giving someone like the beautiful smile that we normally do, but it's about their life. It's about them as a human being and how they can thrive in life. So it's a lot more
holistic.
bigger picture, holistic, but also I just feel like it's way more rewarding than just giving someone a composite,
shiny smile.
a shiny smile.
And you know what? I really like that we're talking about this, because I feel like one of the things that young dentists face is like, what interests me? And all they see on social media is veneers or composite and Invisalign, right? Because I guess it's easy to photograph that and showcase it where other things aren't. So I feel like it's really nice to talk about there are other avenues that you can take that are absolutely just as fulfilling or even more fulfilling, and make such a difference to your patients' lives. Yes, they might not be, the 10 out of 10 Hollywood smile cases, but yeah, you can change lives, guys. So I think it's really important to talk about that, right?
100%. I think at the end of the day, like, I really applaud everyone that has succeeded in doing all the cosmetic dentistry, but I just knew it wasn't for me. And I wanted to.
I feel like I'm the same. Where we have like a similar story, and I feel like I forced myself to do it or to like it. I did the Invisalign. I went on a composite course. I did the nice, composite bonding cases, but it just never was for me. I don't think, like you said, whatever works in your hands, right? So if it's not for you, you don't have to force it, because you feel like everyone else is doing it. And again, like I said, it's more Instagrammable, so that is all we see. But there are so many other arms to dentistry, right?
Massively. And I just feel like I always knew that I wanted to work with children, but I didn't want to go through the traditional NHS pathway of becoming a pediatric dentist. For one reason or another. But essentially, when I found this, I was like, oh, I can still help children, and in a transformative way. I was like,
Exactly. And it's kind
this
of
is it.
more in your own terms, I guess. Right?
Exactly.
Yeah.
Nailed it.
Love that. Okay. Okay. So in terms of working with patients, so you said you're still in mixed practice?
Still in mixed practice
And are you
private
treating your
practice as
own
well.
patients at the moment, or are you treating from referrals? Because I know
Yes.
you've just started out. Don't worry,
Yeah.
that's fine. But you're on the right path, so tell
Yeah.
us about.
So at the moment, essentially in my NHS children's checkups, which are like 15 minutes long,
Yeah.
if I do spot anything, then I inform the parent, and then explain that there's more to this. It's not just about the teeth.
Mm-hmm.
And then if they're interested, then they can book in for like a longer consultation where we can do the full assessment, because 15 minutes is just not long
Yeah.
enough. And then I'm lucky, I guess I'm in practices where the other dentists are really supportive as well. So I've been doing like educating them, and I want to do like lunch and learns so that they understand how to screen.
Mm-hmm.
And then yeah, I've also received like quite a few referrals from other dentists in the practice. So hopefully in the future I can kind of narrow it down to just doing this and
Yeah.
not do so much general dentistry anymore.
Yeah.
Because it is quite conflicting. If an orthodontist says you need, your premolars taken out,
Yeah.
I'm like, did you know that there's another alternative? That's literally what I tell the patient.
Okay.
And then I also ask the orthodontist, or I tell the patient, like, when you go to your orthodontist assessment, say that you really don't want your teeth out, and if there's any other treatment plan that they can think of. Obviously in some cases it's not possible,
Yeah.
but in actually a lot of cases, if the parent pushes for it, they're more likely to keep those premolars
Really?
in. It's very interesting.
That is really
Yeah,
interesting.
so that's top tip for any
Do
general
you
dentists.
feel like orthodontists are like, why is she telling me this?
So I've got quite a good relationship with my orthodontist. I
Good.
have one that actually does like early interceptive on the
Perfect.
NHS, which is amazing. But that's just through connecting, networking,
Yeah.
and just doing that. So I think that I'm very lucky for that.
Yeah.
However, I think if you don't ask,
Yeah.
you won't know. That's one of my mottos in life. If
Yeah.
you don't ask, you won't get it, because you haven't asked. And if the worst is that they say no, then you have that
You've
decision
done your part.
Yeah. And then just like you have that decision whether you think, a composite's better than amalgam, the patient makes the choice.
Mm-hmm. Fine. And I guess a part of treating your patients is you get to network with other professionals as well, because you can't do everything, right? So
Definitely
you
not.
do send them to different professionals.
Yeah.
How did you build that network?
Networking events, I guess. Yeah. So as I said, what I do, I can't do everything by myself.
Yeah.
So we need to make sure that if, for example, you can't ask someone to breathe through their nose if they physically can't. So if they have any sinus issues, or they can only breathe through one nostril, for example, then we would have to refer them to ENT.
Mm-hmm.
And then myofunctional therapy is a massive thing. So essentially, if you basically need to retrain how to use your tongue. So a lot of us now, we only use probably like a quarter of our tongue properly. So all the muscles need to be strengthened in different ways. Just like when you go to the gym, you probably have like really weak biceps at first, but if you train them all the time, then you're going to get stronger biceps. So it's super important that it's a team approach. And then of course I mentioned like body work. So osteopaths that understand that everything is connected, because obviously your head is connected to the rest of your body. So the spine is super important. And naturally tightness in other parts of the body can all be due to something that's happening in your jaw. Because remember, our mandible is the only bone in our body that has two joints. So, when you have like jaw pain, one side's painful, one side's overcompensating, that can also show in like wonky hips or wonky shoulders, a drop. So yeah, it's all connected, and so we've got to work as a team to try and help that patient.
It's just really fascinating to like talk about this because half the time I'm like, that's me. And half the time I'm like, that's my patients. So basically, everybody, I think this can apply to everyone, basically.
Yeah, I mean, there's very few people that are
Oh,
perfect.
perfect. Yeah.
Everyone can always, benefit
Improve.
from
Yeah.
optimizing,
Yeah.
but it's more, the ones that are walking red flags, like guess both of
Like
us, that are
us.
more willing to be like, okay, I actually need to get something done because your neck pain or your shoulder pain's so severe that
Mm,
you want to find a solution,
yeah.
or you tried many things in the past and they haven't worked. So
Mm.
yeah, it might be the answer for you, but if other people don't have any symptoms, then why would you kind of look into it?
Yeah, no, I think it's really important to speak about, and I'm really glad that it's being talked about more. It's like a different part of, I don't know, for me, I think it gives me like a bit more meaning to my career or dentistry, if you know what I mean, because it isn't at the end of the day just like single tooth or just like a smile makeover.
Yeah,
It's like improving someone's quality of life. It's so important. Like we say how a smile makeover is like psychologically improving somebody's life,
definitely.
right, or confidence. This is its own like ball game.
Yeah, I think it's kind of like, how you have the Asian dream of like your parents want you to become a doctor. Feel like
We're there.
killing two
Right.
birds with one stone there.
Exactly.
Yeah,
Yeah.
so I mean, if I can help one person,
Yeah.
and or help hundreds, that it just makes such a big difference.
Mm.
And I know, like, even when I first learnt about it, I thought it was a bit of like oh, not sure if this is like evidence
Evidence-based.
based, but
Yeah.
actually there's loads of evidence out there. It's just that
It's not
it's not
mainstream.
it's not mainstream,
Yeah.
but also it's just not explained in the right way,
Yeah.
and all they fall into the wrong
Holistic.
hands. Yeah.
Yeah.
And then also it's got a bad stigma
Yeah.
with it as well. So by actually debunking all of that and
Mhm.
explaining it in a way that makes sense to the everyday public,
Mhm.
then hopefully we can change that and try and make it a mainstream thing. I actually think like airway dentistry is going to be the
It's the
next big
next
thing.
thing.
Yeah,
I
because it's
really agree with
yeah.
that.
So I wanted to get a little head start, but I'm
Yes.
hoping that more and more people will be able to um, just be aware of it, at least screen for it. And
Yeah.
if it's not your thing and you want to continue
That's
doing your
totally
dentistry job,
fine.
that's absolutely
That's totally
fine.
fine. Yeah.
But at least you know that some of your patients that you haven't been able to help, maybe they can get the help that they need.
Yeah, 100% agree. Okay, so I want to talk more about you.
Okay.
So, in terms of, you mentioned you're doing general dentistry, but you want to more pivot to this. At the moment, how is it juggling the two? Do you feel like you have to wear two different hats?
Yes,
Yeah, why is that?
definitely. So I currently do NHS dentistry, some private dentistry as well. But and then also the orthodontics.
Yeah,
And I'm not an orthodontist,
yeah.
so I am seeing it from a general practitioner point of view. But at the end of the day, like I can see that if they have this like interceptive orthodontics, I can prevent so many of these issues.
Mm-hmm.
But that patient may not want that, for
Yeah.
example, due to finances, or they don't think their kid's ready for braces,
Mm-hmm.
or they know, like historically, that braces only happens when they're 12,
Yeah.
13 years old. So there's many different obstacles. But and then same in adults, it's like people think that snoring is normal.
Mm-hmm.
And then when I tell them that actually that's a sign that
You're not
you're
breathing.
breathing incorrectly,
Yeah,
or like your airways is actually compromised, um, they're like, oh, but that's all I know.
yeah.
But then some patients are open to it. So when I explain to them, it's like, do you sleep well? And they say, no, I never have.
Mm-hmm.
And then I say, oh, have you ever heard of like a snoring device?
Mm-hmm.
They're very open to it. And of course, you need to look at the actual sleep, send them to get a sleep study.
Yeah.
There's actually now home sleep studies that you can do.
Mm-hmm.
So it's a lot more accessible and not as expensive. Yeah, but I feel like if they're not like receptive to it, then of course you've got to wear a different hat, because you still want to put the patient first.
Mm-hmm.
But if you can explain to them why they're getting decay or why they're getting tooth wear,
Yeah.
then it's again the different hat, But I kind of tailor it depending on
Do
the
you
patient.
think that if you were to see, like, if patients were seeking you out for that reason, for airway, for example, it would be a lot easier because obviously you don't have to like justify why you're telling them all this because at the moment you're seeing general checkups and then you're just telling them, by the way, you're not breathing, your skull's like this, your
Yeah,
airway's like this.
yeah.
So it may be just a lot for them to process,
Oh, yeah,
right?
yeah.
And whereas like if you position yourself as like this is I'm an airway dentist, for example, for
Mm.
children. This is people are coming to seek you. It's a little bit different,
Oh,
right? So do you feel like
massively.
that's kind of your goal to get to that?
Yeah, so
Yeah.
I think I was explaining to you earlier, essentially, that at the moment, because I can see it in my checkups, I can explain it to them,
Yeah.
and they may not be like, on board straight away. I always encourage them, like, look, go and do your own research.
Mhm.
If you want more information, I'm more than happy to give you more information about it. And that's been quite good, to be fair. Like some people call back up and they're like, oh, actually, I want to know more, etc.
Yeah.
But yeah, but definitely the patients that already have an understanding of, basically the ones that are more health conscious
Yeah.
are usually the ones that are more receptive.
Hmm.
And they themselves, for example, have gone through like jaw surgery, or like, you hear these patients that have had braces for like 10 years. I'm like, how is that even
Mm.
possible? But it is a thing.
Mm.
And then they don't want their children to go through it. And I'm like, look, there's actually a way where they don't need to follow in your footsteps. But if you leave it, they're going to have exactly the same things that you've
Yeah.
had, because of, the habits that they have. So it's not necessarily because of genetics. It's actually, mostly to do with the environment, because of our modern day diets
Yeah.
and things like that. Um, but yeah, if they can correct these habits early, we can actually give them a better jaw structure. We don't need like the narrow palate that, you may have, but
Mm.
actually give them more space for their tongue to go, so that they can breathe better,
Yeah.
and then they'll grow better as well. So it's just really all education,
Yeah.
for sure.
I think it's just seeing like a variety of patients. I guess in the beginning you have to, right? Because that's
Yeah,
just where everyone starts out. But it is nice to get to that point where I guess the patients know what you already do and they're seeking you out for that.
yeah.
And that's
It obviously
definitely,
makes it easier. So
yeah.
like I have a patient, she's like, whatever you say, I'll do it.
Yeah.
And I'm like,
Thank
oh.
you.
But at the
I
same
am the
time, I'm
professional.
like, wait a minute, I still need to explain what's
Yeah.
going on.
Yeah. But it's
But
nice
it's
when you
great.
feel like, I guess respected, like your knowledge is respected. So
Yeah,
it's like, yeah, I do know more than you as the patient. So
yeah,
I'm gonna guide you because this is what I think.
yeah.
But yeah. And then in terms of preventing, so first tell me about your week. What's your week like at the moment?
Oof. So I'm currently, I don't have any protected time for the ortho that I do,
Mm-hmm.
just because I'm still near the beginning.
Mm-hmm.
However, yeah, so I work at 3 different practices.
Mm-hmm.
Luckily, all of those practices, they're like all zoned.
Mm-hmm.
So I guess within that, the private zones, there are those orthodontic parts in there.
Okay.
So yeah, that's how it is really.
So are you working kind of 5 days at the moment?
Yeah, I'd say 4.5.
Okay.
Yeah.
And what are your hours like? 9 to 5
Oof.
ish or
Uh,
different?
None of mine are 9 to 5 actually.
Okay.
So I'm probably not a good
No, no, it's good to
example.
know because I
Yeah,
think what again I want to highlight to people is that it's not, we don't have to work in the traditional kind of 9 to 5, 8 to 6 or whatever.
yeah,
We can do things to work around our life
that's
because the
true.
benefit of being a dentist and being self-employed is you can kind of dictate your schedule a little bit
Yeah,
more. So
100%. I think
yeah.
work-life balance is so important. At the moment, I feel like I'm working more than I would like, but that's
Mm-hmm.
because I want to try and build up my
Yeah.
experience and have more. I take a lot of time off basically to learn more about airways and interceptive orthodontics. So
Yeah.
I feel like I do have to work a bit more to basically pay my bills.
Okay.
But yeah, at the moment, like my hours are a bit crazy. So on a Monday, it's 8:30 till 6.
Mm.
Tuesday's my long day. It's 7:30 till 8 o'clock at night.
I thought the Monday was the long day.
I know. So
Oh my
Monday and
gosh.
Tuesday, I get it basically out
Yeah,
the way.
killer.
Yeah. And then
Yeah.
Wednesday, I do 7:30 till 1:30. So
Okay.
that's like my half
Get your
day. And then
afternoon.
the afternoon, I basically reset, do any admin I need to do. Thursday is 8:30 till 5.
Mm-hmm.
And then I have Fridays off. So
Okay.
Friday is essentially my admin day, do any clean checks, anything like that.
Mm-hmm.
And then every other Saturday, I do like 9 till 1, 9 till 2.
Okay. Yeah, so again, it's nice to hear because you've probably got like that Wednesday afternoon to look forward to.
100%.
Yeah.
So the
And the
way,
Friday.
yeah, so the way I've done it essentially is that I work most of my time on Monday, Tuesday,
Yeah.
and then I kind of just have like a not a weekend, but like just a little break.
Yeah.
And you know, that's also a time where I can spend it with my friends, my partner. And then on the weekends when I'm not working on the Saturday, I have that long weekend to be able to like see my family or
Exactly. Because you're doing a
quick
lot.
weekend
So
somewhere.
it's nice to
Yeah,
have that break, 100%.
exactly.
Yeah, agreed. And okay, and with your schedule the way it is, you said you would like to work a little bit less than you are currently, but at the moment, how are you preventing yourself from being burnt out or overworked?
Good question. So I feel like it's always so hard to get the balance right. But definitely eating well helps. And sleeping well helps. And for me, like gym is really important. So just working out, not necessarily for like physical gains, but mentally, it just
Yeah.
really helps because obviously you're releasing a lot of happy hormones and just releasing that stress as well.
Yeah.
And yeah, I think like when I first started, like I would worry about anything. I would literally like call up my practice principal and be like, oh, this happened today. And she's like, don't stress about it. Like you haven't killed anyone. And I'm like, oh, okay. And I wouldn't be able to sleep because of it. And now I feel like nothing really phases me.
Yeah.
Yeah. So I think it's just experience for sure. And then I always have something to look forward to. So I even if it's just like a long weekend somewhere, at least that's I know that okay, I will have that time off. And then during my time off, I don't do any work.
Good.
Like unless like someone from my practices messaged me about
Yeah.
something that's important, then of course I'll reply.
Yeah.
But I'm quite strict with what's work and what's not. So I don't bring any work home unless I know it's like my admin day kind of thing. But like I do all my notes at work. So when I come home,
Home
there's
is
no
home.
work. Yeah, exactly. So I think that really works for me because I think if I started doing notes at home and this and that,
You can just get carried
yeah,
away, right? And it
exactly.
just never ends
Yeah.
then.
So I don't even look at like what I've got the next day anymore. I look at just what time I start and I'm like when I go in there, then I'll prepare everything. I mean, I'm at great practices, so I know that the nurses have got my lab work ready. I know, that well, obviously there's sometimes hiccups here and there,
Yeah.
but most of the time they're great. They are. I wouldn't be able to do what I do without them.
Love that. And take me back to when you first qualified.
Okay.
What was the kind of hardest thing that you faced as a young dentist?
Ooh, I would probably say actually like doing the right thing.
Mm.
I think like imposter syndrome was massive. So when you first start, you don't really know anything really. But like even like doing a filling, I would worry that I've left caries behind or that they might need a root canal,
Yeah.
And then you look at all of these amazing Instagram posts, even nowadays, like all of these young dentists coming out, and I'm like, their composites are better than mine, kind of thing. So I think imposter syndrome massively. And I realized actually as long as you've got good communication, good relationship with your patients, and uh, of course explaining them the risks and everything, they you'll be absolutely fine. They're not gonna, be mean to someone that they actually like. So I think soft skills are super important,
Yeah.
and I really try to work on that more than. I mean, of course, I've worked on my clinical dentistry too.
Yeah.
But I've realized that that was what actually helped me with my anxiety.
Yeah, agreed. And I
Yeah,
think again, it does come with experience. Obviously, in the beginning, it all feels a bit foreign, and you haven't got somebody there to check your work and stuff,
exactly.
which was really nice at
It's quite nice that
university.
you don't have to wait like 45
Hours.
minutes for them to come over.
Yeah, yeah. So that was all an experience in
Yeah,
itself. But I think, yeah, it's a common theme. A lot of people have said imposter syndrome.
massively.
And I think it's just because you're on your own compared to other careers where you've got kind of a team around you,
Yeah,
it can be a bit hard to know if you're doing the right thing. But I guess that just comes with experience, right?
exactly. Yeah.
Yeah. Okay. And my next and final question is, if you had a dream job, what would it be? So this is a parallel universe where you're allowed to be
Ooh.
anything you'd like to be.
It would definitely be something with travel,
Yeah.
definitely. So I'm not that tech savvy. Like I really try to like I'm very good at filming content, but can't edit to save my life. And I'm like the worst at actually posting it.
Okay.
But I think definitely traveling to new places. I love discovering like hidden gems
Mm.
and like places where like no one's heard of. So secret, well, not quite secret now that I'm
Yeah.
announcing it, but I would love to go to this country called Palau.
Okay.
It's
Never heard of it.
Palau. It's like,
PA.
yeah, so
Okay.
it's kind of a bit like the
Where is
Maldives,
it?
Bali. It's near like Fiji, Pacific Islands. It's a
Okay.
Pacific island. So probably why no one's heard of it,
Yeah.
but it looks so beautiful. And it's just, yeah, these little tiny places where like no one's even heard of. I would love to just, I guess, raise awareness about that these countries
So you're a
exist.
travel awareness person.
Well, just like showing that the beauty of the world,
Yeah. Would you
in a
host it
different light.
on TV, on Instagram? Would you write a
Ooh.
book? What would you do?
I mean, I think social media is kind of here to stay,
Yeah.
so probably will be somewhere
So a
on
travel
the internet.
vlogger.
Travel
Vlogger.
vlogger?
What do you
Yeah,
call them? Travel
maybe.
influencer.
I don't like the term influencer, but
This is your
yeah,
dream one,
yeah,
so
I
you're
would
allowed to call
say,
it whatever you
yeah,
like.
yeah, a
Travel
travel a
poster.
travel guru.
Yes. Oh my
Yes.
God, I love that.
So
Travel
I would
guru.
love
That's
to
a
like,
great dream
yeah,
job. I love
I
that.
would give people, tips and like where to go, what to eat, and getting like into
I
the
would follow
cultural
you.
thing. Oh,
Yeah,
thank you.
100%. Great. So thank you so much for coming on the
No, thank you
podcast.
so much for
I
inviting
just
me.
have a final message, which is overall, I've loved listening to you talk about all of this. And I just want to say that I know obviously we've been uploading episodes where it's about completely coming out of dentistry, but the idea of this is that we are more than scrubs, even within our scrubs. Like we can do a lot more. It doesn't have to be just the traditional generic thing that we're used to or that we've heard that people are supposed to do. There's a lot out there, and I guess you just find your passion and you do it, right? So are there any messages from you to the listeners? I'm sure loads of people have had this and found it really interesting.
I would say if you feel like you've got a bigger purpose and that you're not happy where you are, change your environment. So I that it applies to so many different like things in life, but if
Mm.
you're not happy, there is happiness somewhere. So
Yeah,
find it, and I promise you, if you you know look for it, you will definitely find it, and you'll get to a point where it'll be like, this is
I'm
right.
here.
Yeah,
Yeah,
I
I've
know this is
landed.
me.
Yeah, so
Yeah,
I think it's not just it. The thing is, if you stay stuck in that environment, obviously nothing is going to change, and it
yeah,
will just bring you down to the point where you're like, it's too hard to move, you know?
exactly.
So I guess if you start to see those signs, even like a small change, I don't know, I guess what would you say? Like different environment, what do you mean?
So, for example, like a lot of people will be like, "Oh, well, in my practice, I can't do that," and I'm like, "Change
Yeah,
practice."
in another practice you can.
Yeah,
So
find
yeah.
one that where they do support you in what you want to do, and it doesn't have to be what I do. It could just
Yeah,
be,
anything.
basically have freedom in
Yeah.
what you can do, and that will make a big difference. But even in your personal life,
Yeah.
like if you're not happy, or you're not happy with, for example, with like what you're eating, well then change the
Change it.
environment. Don't buy those things into your
Yes.
house, and then you'll guess what? You'll less likely have them.
Yeah, I thought of when I started at a practice and I used to sit on a chair that was really opposite of ergonomical, and it used to give me back pain, and I started seeing a chiropractor, and like it was just horrible. And I just changed the chair, right? And it just changed like my working day. So even something as
Exactly.
small as that. So you don't have to basically just be stuck in that situation.
No, yeah. If you don't like it,
Change it.
Yeah, 100%.
Free will. Love free will. Yeah.
Yeah.
Okay, perfect. Thank you so much for coming on.
Thank you so much for having me.